Topham, bringing you the best of beauty. Today we're going to be talking about neuromodulators. The most common neuromodulators that we have are Botox and Dysport. Today we're going to be focusing on treating the older face or the more mature face, which has lost volume. The function of the forehead muscle, the frontalis muscle, is to raise our brows. As we mature, we lose soft tissue in our brows, in our forehead, which causes a natural dropping or hooding effect of the brow. So here we are with a mature patient, 58 years old. We're treating today her forehead, her glabella, and her crow's feet. And as mentioned earlier, as we age and we lose the volume, our brows tend to come down slightly. We want to get rid of the static lines. Can you go ahead and raise your brows for me? So relax. We want to get rid of these lines, but we have to treat someone who's 58 very differently than someone who's 30, because she already has a slight drooping of her brow. So she'll have still a little movement of her brow here, but it will be a much more natural look and her brow will stay elevated. So we're going to go ahead and start. And again, injecting someone who's 58 is very different than injecting somebody who's 30. Someone who's 30, I can get a little bit of a raise laterally or a little bit of a raise medially. Someone who already has a little bit of a dropped brow, that can't happen. So go ahead and raise your brow for me. So Michelle, it has been treated topically with a topical injectable with a topical cream that makes her numb. And you can see I'm injecting her very high. And I always bring people back 2 weeks after their injection in case I need to tweak them and help them at all. Now we're going to do in between her eyes or her glabella. So I asked the patient to animate, and I'm going to place some material in her corrugator as well as her procerus muscle. And then these little horizontal lines here. And then her nasalis muscle here, which gives her a little bunny line look. Tilt towards me. How are you doing? The areas of the face that we use neuromodulators, Botox or Dysport, are the forehead to soften static lines, the crow's feet to soften crow's feet, the glabella to get rid of that angry look. We also can put it in the jaw to soften somebody who grinds their teeth. Another popular area is the chin or mentalis muscle, just to smoothen out. It's called peau d'orange or skin of the orange. Lastly is the DAO muscle, which brings a downward pull of the mouth. Lastly, we're going to be treating Michelle's crow's feet. You'll see that she has static lines, meaning when she's not making animation, you can see the lines. Botox alone here is not going to do the trick because of the excess skin. So first I'm going to deaden the muscle, and then Michelle is going to come back and have some additional fillers done to fill in some of the volume loss that she's had. So she'll have her cheeks injected, she'll have a little bit of her lid cheek junction injected with a filler, as well as her temples. So we're going to start to open up her face. If you'd like to know any more information on that, please visit our YouTube channel. Just maybe turn a little tiny bit, good. Now if you can see this little tiny ink line here, I'm going to knock that out by just putting a little bit of Botox in here. Sometimes when we're more mature, we get a little accordion look here, and with just little drops of Botox, we can smoothen those out. Botox and or Dysport lasts anywhere from 3 to 6 months. If you are new to my practice and have never had it before, I usually bring you back at 3 to 4 month intervals for about the first year. It's all about maintenance. I've been having Botox for 20 some odd years. I get about 6 to 7 months out of the product. We usually like to have symmetry of the face. So as we're younger, we can get away with maybe just the 11s or the glabella. As we get a little bit more mature, it makes more sense to do these two areas together. In conjunction with injecting areas of the upper face with Botox or Dysport, the forehead, the glabella, the crow's feet, please refer to my YouTube videos on Artefill, which is now called Bellafill, Voluma, Radiesse on my YouTube channel. I'm Lisa Topham. Thank you for watching. Please subscribe to my YouTube channel and visit my Facebook page for further information. Thank you.